Pleased to have you. Is recording in progress. We're very pleased to have you. I'm Ariel Bringle. I'm a program coordinator here at NHMA, and I'll be moderating the session today. We have just a couple of housekeeping tips for everyone. There will be a time for Q&A at the end. So if everyone can please be mindful and put your questions in the chat box, I will be taking those questions and we'll be asking the panelists at the end of their conversations. I ask that everyone please have their microphones muted during the presentations. You may have your camera on if you like, but please keep your microphones muted. And a recording of this will be available on the NHMA website sometime next week. So we are going to have our welcoming remarks with Dr. Elena Rios.
Yeah, hi everyone. It's a pleasure to be here with the Northern California chapter. And yes, we did invite others from California. I want to congratulate Jessica Nunez de Ibarra for, being a longtime leader in California and with the Sacramento Latino Medical Association. And also Jessica has been a fellow of the NHMA. And we hope to do more in California with advocacy. We have started advocacy efforts over the years with diversity in the workforce and heart disease and prevention. We've had obesity summits in Sacramento. And I think that the National Hispanic Medical Association's interest is to get to know you and doctors and medical students, residents, and other health professionals interested in helping our communities. So whatever we can do to be of service, we look forward to today's event. And I just want to say that all the speakers today have some opportunities to offer. And I have to say on behalf of the board of directors that we hope that you would join our organization as a member and perhaps sponsor the scholarship program that we have and get involved in the opportunities that you're going to hear about. I just got off a phone call with a county public health department here in Virginia who was awarded an Office of Minority Health $3.5 million grant. And NHMA will be developing webinars and speakers on health literacy for doctors in the Fairfax County who are not necessarily Hispanic, but there's quite a few growing Hispanic populations in the area. And they would like us to find doctors who can be speakers and develop the curriculum. So we look forward to even those kinds of opportunities for your expertise and knowledge. It's so important that we cross learn and sharing our resources through our websites and portals with all of you. So thank you very much for being here. Thanks, Ariel, for moderating.
Thank you, Dr. Rios. Thank you for being here tonight as well and doing our welcoming remarks. Let's go ahead. Our first speaker is going to be Dr. Picasso. Dr. Picasso, would you like to get started?
Yeah, that'd be great. Thank you for having me. All right. As Ariel kindly mentioned, my name is Fernando Picasso. I am a current pulmonary and critical care fellow at the University of Washington. And as you can see, I wasn't able to leave work early to make it for the meeting. So thank you for tolerating my scrubs attire. I'm just down the hall from the medical ICU. So in starting the talk, first off, just no disclosures. Next slide, please. So I'd like to begin this conversation mainly by telling you a little bit about myself and how that sort of fits into fellowship through the National Hispanic Health Foundation. So first off, I am Mexican American. I grew up in a farm worker family in Southern California. So spent a lot of time in the fields with my parents and extended family. And that sort of framed my path going forward. Despite spending a lot of time doing manual labor, my family really valued education, and my parents' big dream for me was to have a job where I could work in an office with air conditioning. And to meet that goal, I eventually became a first-generation college student down in San Diego, where I developed an interest in science and biology. And became an interpreter in a free clinic, and that's sort of what started me on this path to medicine. I eventually went to Arizona for medical school and ended up pursuing internal medicine residency at UCSF in San Francisco, and just finished that, and now starting fellowship here at the University of Washington in Seattle, where nearby they have a big farm worker communities, and ultimately hope to pursue a career in physician science as a physician scientist, at studying the intersection of pulmonary medicine and health equity, and sort of bringing my roots to medicine and science. And I highlight this path mainly as sort of a framework for what I'll talk about with regard to mentorship in the coming slides. Next slide. Was I muted there? Oh, I'm sorry about that. Sorry, give me 1 second. I apologize and appreciate your patience. I'm in the medical ICU, so there may be people popping in for emergent dietary needs in the break room. Referring to the Health Professional Student Scholarship, so sort of the logistic details is that this scholarship provides $5,000 a year for up to 3 years for health professional students. And with this program comes enrollment in a mentorship program, and which I'll talk about throughout this brief talk. And since 2017, 40 students have participated in this mentorship program thus far. I highlight the letterhead off to the left, which was my own notification of the scholarship back in 2016. And so really honored and privileged to have been a part of this scholarship as a starting as a third year medical student many years ago. Next slide. And so what is the importance of mentorship, particularly in the Latinx community and those of us in medicine? Those who are able to have, those who are underrepresented in medicine and are able to have mentorship have better outcomes. They're better integrated into the STEM community, the science, technology, engineering, and medicine community. They end up having greater research productivity during their science careers. There's improved recruitment of others who are underrepresented in medicine at all levels of training, as well as increased preparedness for junior faculty and increased career satisfaction. So you can see that there are many benefits of having mentorship, and being a part of an organization that can provide that. It plays an important role in achieving these better outcomes for people like myself who are Latinx, first generation, and don't have the same social capital as others who have many generations of higher education and medical careers. Next slide. And so you'd think that having all this data, knowing that people have better outcomes with mentorship, we would address it appropriately. Despite all that, there is this mentoring gap as famously highlighted in this Harvard Law Review many years ago, essentially saying what I've sort of illustrated, that those who have the privilege of growing up in a space where there's sufficient social capital are able to navigate careers in medicine and science a bit better, and those of us who have less of that have a harder time. And so bridging that gap is really important. Next slide. Which brings me to my last slide, which is a photo of me, one of my last slides, I should say, a photo of me with my parents, highlighting myself at the Los Angeles Gala in 2016, receiving my NHHF scholarship. And I point to this slide mainly to sort of illustrate the full circle journey that I've gone through. So now as a fellow training to be a pulmonary and critical care physician, in the height of a pulmonary pandemic. I'm really honored to be able to serve as a mentor this time around. So working with a current scholarship recipient and sort of helping her through the sort of next steps of her medical career. Currently working on getting through the residency applications and navigating that those next steps. And again, just highlighting the critical importance of having somebody that looks like you in that next step, and hoping to maximize that opportunity. And we'll just highlight this as an opportunity for you all and people you all know to be able to take part in this program as mentors or as sponsors of the scholarship, knowing that it helps people like me get to where I am today, and knowing that people like me are going to continue to pay that forward in the future. Next slide, please. These are just a few of my references, and then next slide. So thank you all for humoring me and for being so patient with my current presentation conditions, and just highlighting a few of my personal mentors here who have been mentors to me in clinical medicine and in science, and have some of them have looked like me. Two out of the three are Latinx men who have come before me and sort of shown me the ropes and helped me get to where I am today. And as well as my parents and family who didn't make the cut in the photos here since they got one earlier, but wouldn't be here without them. Thank you all.
Thank you so much, Dr. Picasso. I love that full circle. I didn't know that you were a recipient of our scholarship when we had asked you to talk about the mentorship, which just sweetens the pot a little bit more. It's really exciting to see that you're still involved with NHMA and that you're really utilizing your talents here. So thank you so much for that. So we're going to go to our next presenter, which is going to be Dr. Aisha Umrigar. And Aisha, would you like to introduce yourself a little bit?
Sure. Good evening, everyone. I'm Dr. Aisha Umrigar. I'm the engagement lead for the All of Us research program at our New Orleans site. So hello to everyone from New Orleans. I'm really happy to be here this evening to tell you all about All of Us. So next slide, please. So this, the All of Us research program is part of the National Institutes of Health initiative to advance precision medicine. So the idea is to gather 1 million people from across the United States to accomplish this goal. Precision medicine takes into account not just, but also your socioeconomic factors, your lifestyle, and your environment, because these factors play as much of a role in your health and your health care as do your biological characteristics. And so the end goal from this initiative is to advance precision medicine. And this means to, instead of medicine being more like a one-size-fits-all thing for everyone, the idea is to make it more tailored towards an individual person. Next slide, please. So the All of Us research program, this is not a clinical trial. So we're not studying any one particular disease or condition. The idea is for people to donate different kinds of health data, and then researchers can use that data to study whatever their particular disease or area of interest is. For example, on this slide, we look at some of the things that a resource of this type could help answer. So we say researchers who are studying chronic pain, they could learn more about that. We could learn more about different types of dementia, treatments for diabetes, cancer, and also, since this is focused on not just your biological characteristics, but lifestyle and environment as well, it also looks at ways to support health equity. Next slide, please. So All of Us is different from other studies. First, being at the scale that it is. So it's a huge initiative. I mean, we have sites all over the United States. And like I mentioned earlier, the idea is to recruit 1 million or more people who are from underrepresented backgrounds. And this can be underrepresentation in demographics, geographically, medically. Like particular populations are currently underrepresented in biomedical research. And this can make developing treatments and interventions for these populations somewhat tricky. There's also a diversity in the types of data collected. So, and also this data is being collected over the span of 10 years, which, I mean, it's great to follow people over the course of 10 years because different things are going to happen over the course of 10 years. Some people are going to get sick, some people are going to stay healthy. And by researchers being able to have this data, it gives them more information onto what's keeping these people healthy or, you know, causing them to get sick. Like I mentioned, this program does collect different types of data. So that includes clinical, environmental, genetic, behavioral. There is a very strong focus on participants as partners. So participants are in the governance of this program. We here in the southern region of the with Louisiana, Mississippi, Alabama, we actually have participants on our community advisory boards who give us feedback about, you know, the direction the program is going and what they feel are the positive aspects of the program and how we can do things better. So they were also included into the development of the program. So they give input into the science and also the information that participants can receive back from the program. This is a national open resource for all. I'll go into the privacy protections a little later than the slide, so it's not any data that's donated to the program is de-identified and protected. I'll go into that in a little bit detail later. But for researchers who go through an they can then use this data and open source software and tools to conduct their studies. Next slide, please. So for participants, they have the opportunity to improve the health, not just for themselves, but for future generations. Because like I mentioned, this particular program is expected to span over the course of 10 years. And medicine is really heading towards precision medicine. And so the studies that we do today can help advance medicine into the future. You do also have a chance to learn a bit more about your own health. So you do get certain results back. If you come in for a clinic visit, which I'll talk about that a little later in this presentation, you get to see your blood pressure readings, your BMI, all that good stuff. And you also get access to certain genetic testing results as well. This is also an opportunity to ensure that your community is included in research. It is a really big issue that the underrepresentation of certain populations within research. Like I mentioned earlier, the less we know about certain individuals, the less we know about how well certain medications and treatments will work in that population. We also do provide our participants with additional research opportunities should they be interested. And there's also the chance to meet other people like you who may also be interested in participating in research studies. Next slide, please. So for researchers, there's the opportunity to save time and resources. So one of the big issues that researchers face is one, not having a diverse enough pool of participants for their studies, and two, not having enough for them. This is especially important in diseases such as like heart disease or diabetes, where you really study a lot of people to get an idea of what are the contributing factors to these diseases. So this can help researchers out in that aspect. Like I mentioned before, this is a very rich resource of data. So it's going to include not only the biospecimens, but it also includes electronic health records, de-identified, of course, but you do, researchers who go through an approval process can access that information. And like I said, this is a longitudinal data set that follows participants over the course of 10 years. So you're not just getting the data from them in the moment, you get it long-term. And like I mentioned, it's also a very diverse cohort of participants. Next slide, please. So for providers, like I mentioned, the future of medicine is heading towards this more precision style medicine. So we really are trying to also, in addition to biological characteristics, find out the impact of the environment and lifestyle factors to health. Will help us find out risk factors among diverse populations. Gives us more information on development of conditions that may allow for earlier detection and allow for better stratification. So this, I mean, in addition, like I said, in addition to knowing the biological characteristics, you also get information about individuals' environment and lifestyle factors. And this is actually very important in being able to actually address health disparities. Because like I mentioned, it's not just your biological characteristics, it's where you live and how you live as well. Next slide, please. So I'm just very briefly going to talk about what's involved in the program. So at the present, you do have to be 18 years old or older to enroll in the program. It's an online interactive consent, and you do have the choice as to whether you want to share your electronic health records, whether you want to get your DNA result or not. Then you answer a series of surveys that cover various characteristics. It's demographics, lifestyle, healthcare access, family history. And then you may be invited to come in for a clinic visit. Well, they're measured these characteristics over here. And you can also choose to provide a blood specimen for DNA analysis and a urine specimen as well. If you have a Fitbit or wearables, you can also sync those with the program as well. Next slide, please. So I do also want to talk a little bit more about privacy and security. So like I mentioned before, your data is not just freely out there. Any data that's donated to the program, it's de-identified. So anything that can be linked back to you, those identifiers are removed. Researchers do have to go through a training process and adhere to a code of conduct. And the data is protected in warehouses with advanced. Next slide, please. So I just want to talk a little bit more about what the National Hispanic Medical Association is doing with the All of Us research program. So they've hosted various fireside chats with experts from these various national organizations. They also stream these to social media and host other social media activities talking about All of Us in precision medicine. If you are a physician, you can go to their website and they actually have materials for physicians that are branded with the NHMA logo and All of Us. And during their conference, they hosted an informative virtual panel discussion. There is also a virtual lottery board game. So if you go to this link over here, you can go ahead and download it and play that. Next slide, please. And if you would like to get involved in the program, you can go ahead and visit this website over here. That's joinallofus.org/together, or NHMA's website and navigate to their All of Us section. You can also join various events on social media to engage with the program. You can download and request materials. And also please talk with your patients and family members about this as well. And if you have any questions, you can email Vito. His email is over here. Next slide, please. And thank you all very much. I greatly appreciate you having me here this evening. And that is it for me. Thank you all very much. Oh, and one thing before I turn it over, if you could all please let us know how we're doing and fill out this post survey. That would be great. I think you all must have had the pre-survey in your welcome packet, but if not, please go ahead and complete that as well, and also fill out our post survey. Thank
you, Dr. Amagar. We so appreciate you being here to talk to our California chapter about how they can get involved with the All of Us program here at NHMA. I'm going to go ahead and now introduce Ms. Nishagandhi.
Thank you. Next slide, please. My name is Nishagandhi, and I am with the California Department of Public Health. I'm the Adult Immunization Coordinator, and I'm going to spend a few minutes talking about our COVID-19 vaccine program, provider enrollment, and some grant opportunities that are available. Next slide, please. So what I will do is kind of go through the program rather quickly. I really wanted to just take a few minutes to highlight some of the benefits of the program, what enrollment looks like now, and then talk about grant opportunities. We do have lots of webinars available and materials available for anyone who's interested, and we can certainly dive in deeper in other places to explain some of the nuances of the program and all of its benefits, but really just talking about what we're seeing with the program now in light of all of the changes that we have seen over the past couple of weeks, the rise in cases and everything that we are dealing with in this current environment. So right now we have around 7,000 approved providers in the program. We do see the need for additional expert vaccinators as we're looking at the next age group to be vaccinated. So this is the youngest. This is all those under the age of 12. And not only are we looking at this change in licensure for a vaccine in this fall, we're also looking at third doses. So the third doses that have been recommended for immunocompromised, and then booster doses. So the need for vaccinators continues to be there. And we're also moving from a model where we went from mass vaccination clinics to really looking at our routine vaccinators, our expert vaccinators, those who vaccinate day in, day out, and how do we really tap into that network and how do we tap into that network and get COVID vaccines out through that mechanism. So the enrollment process, it is streamlined. The process has evolved quite a bit over the past several months, and we have done what we can to sort of streamline it as much as possible and offer individual support when submitting an application. We have worked with California Medical Association and also worked with Accenture, who has a help desk that's really helped with helping providers as they step through the enrollment, because it is I wouldn't say a complex process, it's just a multi-step process. And so there's plenty of support available for those who start the process. Next slide, please. So this is our portal. It is mycavax.cdph.ca.gov. The CDC provider agreement is located in here. We've taken the agreement and we've converted it electronically and collected all the information here. This portal is where orders will be placed. This is where you will check tracking info. This is where all the communications that we do with our providers in the program are generated. So this is where everything begins and ends. This is the universe. Next slide, please. So I wanted to shift gears and talk about the Calvex grant practice support. It is a grant opportunity that is provided to those providers who complete a Section A and Section B of the Mycavax application. Section A is at the organization level and B is at the location level. So physician medical practices with 200 physicians or less within the organization or an independent pharmacy organization is eligible. Each site can apply for $10,000 per site and up to 5 sites per location. And all these expenditures are from November 1st, 2020 through November 1st, 2021. So this is retroactive. So those providers already approved in the system can apply for this grant. The only stipulation is have not received pandemic grant funds through the State Innovation Fund, and I think very few providers have received that. And there is $40 million available, which ends up being about 3,000 to 4,000 organizations. To give you some perspective, to date, a little over 1,000 providers have submitted applications. So there is still plenty of money left. Next slide, I think, has the details. Okay, so the grant launched on July 12th and has been, the deadline is September 10th. So we are still accepting applications and will continue so for the next several weeks. There are requirements in place, and what is nice about the funding that's available is that it really covers a broad list of allowable expenses. So staffing, training, technology, infrastructure, supplies, anything that went into offering COVID vaccine clinics in a provider office can be considered an allowable expense. So this, we really hope, will help providers who are on the board about enrolling in the program go ahead and start the enrollment knowing that there is some funds available. You have to place your order for the vaccine through Mycavax and then just follow all the conditions within the awardee agreement. Next slide, please. So this is the all-important contact slide. You need who to email with questions. There's a website, thecalvexgrant.org. There's also email for very specific questions and a phone number. And as noted, the email is the best way to get questions answered. So with that, I will turn it back over to you.
Thank you, Nisha. Thank you so much. That's some really valuable information that I think that our attendees will be able to utilize. And I just wanted to remind everyone, if you have any questions, please bring those down into the chat and we will address them at the end. So I'm going to now bring up Miss Jasmine Alfonso.
Hi, everybody. I'm Jasmine Alfonso. I'm the Director of Programs at NHMA, and I'm so thrilled to be here today to talk to you about our Vaccinate for All campaign. Next slide. Great. Next slide. Okay, great. So what is Vaccinate for All and what is the National Hispanic Association doing? In March of 2012, NHMA launched its Vaccinate for All campaign in support with the CDC, Johnson & Johnson. And the purpose was to really help reduce vaccine hesitancy, build vaccine confidence, and address the structural and cultural barriers to COVID-19 vaccine and specifically Latino communities. Why is that important? The health impacts of COVID-19 and the pandemic have been detrimental to the Latino communities. NHMA, realizing that, really wanted to work with the CDC in order to help with messaging and really help target the Hispanic community to help understand the importance of getting the vaccination. Despite the calls for nationwide vaccination efforts, many communities of color still remain uncertain about the vaccine and lack trust in medical institutions. So it was really important for NHMA to come up to the plate, building this Vaccinate for All campaign to really help arming physicians, arming professional association, other leaders with educational resources about COVID-19, the vaccines, and really how to work within the community and how to continue to support the Hispanic community during this really unprecedented time and explain the importance of the vaccine. Next slide. So how are we doing that? We are doing that in a couple of different ways here. And one of them is that we are working to build out a network of champions. What is a champion? So we're really working with individuals who serve as ambassadors for the Vaccinate for All campaign. So myself as an individual, I support the Vaccinate for All campaign through social media. I've worked on setting up videos, talking about, the Vaccinate for All. I've gotten my family involved to become individual champions and friends. Like, just how do we talk to other people and really share and support and help with vaccine uptake? And it causes that ripple effect within the individual champion. So if I got vaccinated, then my cousin will see that it's okay to get vaccinated and vice versa. And then we will just continue that effect. So we really want to work with individuals who can talk one-on-one. Sometimes it just takes one person talking to another person. So we really want to support those efforts by doing that. And we're really focusing on numerous of different ways to get involved. But individuals are really key part of our campaign because they're really on the ground talking to those that are the most resistant. And then we have the second tier here, which is going to be our organizational champions, which is such a crucial part of the Vaccinate for All campaign. And we're working with all different types of organizations, organizations outside of the Latino community, medical associations that are part of the Hispanic community, all different types of organizations, anything from medical associations to other organizations to groups. We're just working with any type of organization that is willing to work together to share resources. And that includes other vaccination campaigns. We're all kind of trying to row in the same boat together rather than row separately. Let's work together towards a common goal. So we're doing that in a number of different ways with our organizational champions. And one of them is really having them work with us on our COVID-19 briefings, which is something that we do monthly. really bringing in different organizations, different perspectives to continue to talk as COVID-19 continues to change. It's really important that we're all working together and talking about how we can continue to work together to increase vaccine uptake. Next slide. So how do our champions coordinate with NHMA? So there's numerous different ways to do that, but the first step to become a champion is to actually register. So we have a Google Forms. I'll provide this in the chat after as well, and where you can sign up to become a champion. So you'll receive e-blasts from NHMA of different types of opportunities that are coming up, whether that be webinars that we do, as I mentioned, that we do monthly, whether that be opportunities like this that we're talking about right now, whether that be vaccination sites that are happening locally in your community, which we'll talk a little more about, or volunteer opportunities. So we're really trying to just provide our champions and really combat them on the ground with all the types of information that we have and how we can continue to do that. We're also working right now to create toolkits, fact sheets, one-pagers, new resources that we can continue to send out to you. As messaging is constantly changing, it's really important to us that we're continuing to be on the front end of that, and that is in English and Spanish materials that we can continue to disseminate. And it's really important that we continue to get those information and those materials out to you and really post them on our social media and also disseminate that. So if it comes to an individual champion that's wondering, like, how do I talk to my mom who doesn't want to get vaccinated? We want to provide you with that information to just make things a little easier to you as you tackle that in your own life in order to help others to get vaccinated. Next slide. How NHMA supports Vaccinate for All champions. So as I mentioned, there's a few different things that we do with champions. We're finding new ways to plug them into the work that we're doing every day. One of them is our e-blast that we'll be having in our newsletter, where we provide highlights. We celebrate those that are having vaccination efforts, which many of our chapters and doctors have been doing on the ground, which has been amazing to see their support and what they've been able to mobilize on the ground to help in the community on top of their full-time jobs. So we really appreciate the work that they're doing and how we can continue to support that and provide those community events to our champions so that they can share that and they can, again, get more people out to these homebound and mobilization events. We like to spotlight our organization individual champions on social media. So we want to boost up upcoming activations, any videos, photos that you sent. I'm proud to say even my mom was featured in a video of one of our posts speaking about Vaccinate for All as an individual champion. It just shows that it's important to reach out to those around you to advocate for vaccinations, and especially with the Hispanic community. So again, as I mentioned before, NHMA likes to plug champions and partners in the events that we're doing, especially our organizational champions, giving them opportunities to speak on our COVID-19 virtual briefings, which are held monthly. We also have other different types of webinar virtual events right now. We're hoping to have more in-person events and a conference coming up in March. So we really want to continue to work with our champions and really help them to be able to continue to be connected with NHMA. And then, of course, the media opportunities are really, really important. So amplifying our members, our champions, and the media opportunities that they have, any articles, events that are happening, we want to continue to amplify those efforts and really make sure that we're pushing those messaging out there and supporting the great work that our champions are doing on the ground. Next slide, please. Okay, great. And then another part of Vaccinate for All is NHMA's organizational training. NHMA has now just established for this year, we just started 2 weeks ago, our NHMA Leadership Fellowship, which is really exciting. So we have trainings now every Friday that are going to lead up to October, but we have 20 Hispanic physicians who are going to be working and training on public policy and really learning from experts in the field who are going to be able to provide them with so many more information on leadership and public health priorities for impacting the Hispanic communities. So for those, these 20 Hispanic physicians who are so already motivated, doing so much within their communities already, and really looking for those leadership skills to take even what they're doing now and just take it even further, especially within public health. So learning about policy and understanding how that works. How can we impact and really create policies that impact the Hispanic community? How do we get there? How are you able to do that? And that's what these trainings are really all about. So on the public policy side, on the state side, that legislative side, the federal policy, budgets, stakeholders, media, foundations, and different industries. So it's a really great opportunity for these individuals who are part of our Vaccinate for All campaign and all champions and themselves as well. And in this leadership fellowship, we're also going to have an opportunity for them that is going to be around January or in February. We're still, finding out exactly when we're going to hold it, but we are going to be bringing them all to Washington, D.C., where they're going to be able to meet with congressional leaders. They're going to be able to meet with different federal agencies. And it's really important for them to put their perspective, their opinions out there to these leaders, and especially talk to them and advocate for what they see is happening in their community and what things can be better for the Hispanic community. So we're very excited, and there'll be a lot more developments coming within this great leadership fellowship program. And then we also have monthly leadership discussions. So we have a wonderful opportunity with the Hispanic Health Professionals Network, which is just made up of just a robust different types of Hispanic organizations and professional groups that are really coming together to just solve problems together. As I mentioned before, trying to row in the same boat together rather separately. We all want to continue to help the Hispanic community. We really want to make sure to help those health disparities and make sure that we're communicating with the Hispanic community in the best way that we can. And what better way to do that than working together? So this is made up of medical societies and Latino health advocacy organizations, and this is held monthly. Next slide, please. So another part of the Vaccinate for All, as you can see, it's a great robust program that we have here. Lots of different layers, but one of the exciting layers, which leads us to why I'm here today, is really our chapters. So we're very proud of the chapters that we have at NHMA and continuing to establish them and help them support them during this pandemic and during this time where we know that healthcare professionals have been pushed to the brink, but even though they're doing all of that, they want to continue to serve in their community because they know the importance of serving their community and getting their community vaccinated. That being said, as part of the Vaccinate for All program, we want to go ahead and work with our chapters to be able to support them on the local activations that they're doing to help their communities get vaccinated. So we have an opportunity now where we are working with our chapters and saying, hey, if you're doing something, send us a proposal of how you would like us to support you. How can NHMA support you in the work that you're doing in the community? We know as a national organization, we can't be everywhere, but our chapters can. And they can really impact the community, and NHMA wants to do what they can to support that. So it's really important for our chapters to be aware that this opportunity is there. And our very own Ariel, who is our chapter membership liaison, is the one that you would work with to establish that. So if you just have a small idea that you just want to talk about and flesh out, we're happy to do that with you until create that proposal for you to see how we can support you with what you want to do to impact the community. So we'll be taking those proposals till around the end of September. So please get that in and encourage your other chapter leaders to submit. Next slide, please. So impact to date, and this is constantly changing and always getting updated. So the slide is already out of date because so much is already changing in what we're doing. But we've already had such a great experience with what we have done. The Vaccinate for All champions is almost to 200 at this point. We've seen more activations with our chapters. Our social media traffic is continuing to increase, which we're really proud of that activity and the work that our champions are doing to amplify our efforts and really supporting that. We're continuing to media train our physicians, especially in putting them in mainstream markets. So we're working with Telemundo and other outlets to really put that Hispanic physician face out there and really have their voice to be heard and understanding what needs to be said in the community, especially in Spanish, which is very important. And then, of course, we've had over 11 community vaccination events that NHMA has supported, and we're very proud to continue to do that. Next slide. Great. And as part of our Vaccinate for All efforts, we are also launching, which will launch in September, is our HispanicHealth.info. So we realize that there is a large gap in terms of understanding health literacy, understanding where the facts are. There's so much misinformation out there. And unfortunately, the Hispanic community is getting targeted a lot with this. And so like, what can you believe? Where can I go to find the facts? What news source can I find? Like, who can I really trust? That's where NHMA comes in. We really want to build out a portal designed to share resources related to Hispanics for providers, patient, and community members, where they can come to get trusted resources about the facts and the things that are affecting specifically the Hispanic community. So whether that be from heart disease to COVID-19 to diabetes, to HIV and more, we really want to make sure to provide that. So we're going to have two sides to this great portal, which is going to be the professional side and then the patient side, where you can really get those easily digestible information, and then more the research heavy side. So we're so excited about this launch. We think it's so important to bridge that gap and really have a safe haven for the Hispanic community to get all that information that they really need and find the facts. And we want NHMA to be the ones to be able to provide that. Next slide, please. Great. So we'll submit any questions that you have within the chat here. It was such a pleasure to be here today. We're so excited. And please join our Vaccinate for All efforts. I'll provide it in the chat, but thank you so much for having me here today.
Thank you so much, Jasmine. Thank you everyone for joining us. I don't see any questions so far in the chat, but if our panelists want to turn their cameras on, I can ask a couple of questions if our attendees are a little shy at the moment. I wanted to ask Dr. Picasso first off, if you're available. I know you're still at the hospital, but I wanted to ask you because as I'm working with our chapters and our members, I see such a need for our younger up and coming health professionals to be mentored. And I was wondering what you might say to someone who is thinking about mentoring, but has a busy schedule, which I'm obviously that you do, and is kind of on the fence. What would you say to someone like that?
Yeah, that's a great question. And I think something that comes up often. And in academia, at least, it's especially tough because there's a lot of competing priorities, like applying for grants and doing clinical work and not having protected time. That's part of like the salary package for physicians. And that's definitely like a big issue. For me, what I've found is that being a mentor and having a mentee who shares interests and is who I'm able to sort of help guide through the next steps and be someone for them that I didn't have at that time or had a harder time finding has been really rewarding, and is in a way for me that I sort of feel more grounded and am able to just get more joy from what I do in general. And so I'd highly recommend, and it's really a much more manageable commitment than it might seem initially.
Thank you. That's great and great feedback. I do have a question for Nisha. After hearing your presentation and kind of just thinking about the pandemic and the issue with getting everyone vaccinated, what do you think is one of the bigger obstacles that physicians are facing when deciding to provide the COVID-19 vaccine? And do you think that MyTurn addresses those obstacles?
That is a fantastic question. And actually, I do think we have a presentation that we forgot to go through, the MyTurn Volunteer. And so I think if we have a few minutes, we'd love to turn it over, because I think that there are many things that we can talk about in MyTurn Volunteer. But this question about getting more providers involved in the vaccine network is critical, and we've been talking about it quite a bit. I do think that the program has evolved so much from when it first launched back in November. With not only has the program launched, the vaccine has changed, the way it's stored has changed, the volume of shipments. There's many things that have really evolved over time, and I think all of this rapidly changing environment has kept some providers at bay, and we understand it has been it's been a challenging situation. And we are finally at a place, though, where many aspects of the program are more stable and certainly more appealing to providers that are both smaller providers. So someone who may only want 50 or 70 doses to start out with, or someone who wants, they want fewer doses, they want to test the waters first, they want to see how it goes. That's where the Calvex grant can help with sort of those expenses that come out. There's also with DHCS a lot of benefits that incentives that are coming down the pike as well. So there's plenty of, we have seen hesitance on the provider side, and we just want to be able to address them as best as we can. And these are some of the barriers that we've seen. We're also continuing to collect barriers. So as we hear them, we'd love to be able to take them on and address them, because I think that there are so many different reasons and many are misconceptions that we would just like to clarify. And I was talking to a few colleagues earlier today, we are neck deep in this. And so we know all the changes to the program, but if you're not thinking about the program day in, day out, you're probably not aware of how much it has evolved over time.
Yeah, and I think that you're not alone in, the misinformation around getting the vaccine, but also maybe the misinformation about how challenging or how unchallenging it might be to provide the vaccine for patients. Dr. Rios, did you have any questions?
No, I think what's important, Nisha, is we help with continuing to promote your program. The doctors in California, there's a lot of doctors that are out there in practice. In fact, I got a call from a doctor in San Diego who wants to start an interest group with NHMA that are private practice doctors. We hear a lot of doctors from clinics and from academic world who aren't necessarily owners of their own businesses. And, it's hard for the private practice doctors to survive, especially in our communities where there's such a demand and, for Spanish speaking doctors, especially. So we're, whatever we can do to help with finding more of the Latino doctors that are in practice in California to join your program, I think it's important to know. And the other thing, I'll just say that we're very happy, and I know I told Jessica this, Jessica, hi. We are very happy that the governor and your legislature passed the 16 million for HCOP, the Health Careers Opportunity Program, to help all of the, and I'm not going to say just University of California, because I'm sure the University of California medical schools are going to end up partnering with community colleges and the state schools and the private schools to build more conferences in California for especially the disadvantaged students. And the other program that got funded that we work with closely is the Charles R. Drew University that got $50 million to develop a 4-year medical school in California. We wrote letters of support for both programs to the governors and to the legislative leaders. And I know that some of our doctors, like Dr. Kathy Flores, have been instrumental in the coalitions in California. And we're very happy to continue to build networks in California.
Thank you, Dr. Rios. That's fantastic. I believe, did we have another presentation, Nisha, for my turn? Did we want to give the presenter a few minutes in these last moments?
Yes, my apologies. Yes. So I'm going to turn it over to Jadana, and I'm sorry if I mispronounced your name, for California Volunteer to talk about this special opportunity that is available for providers.
Perfect. Yeah, and it's Jadana, like Madonna, but a J. So thanks so much. So nice to meet you all. Lisa and I are on the line. So my name is Jadana Keim. I'm Deputy Director of Emergency Operations with California Volunteers Office of the Governor. Super excited to be here this evening. And on the line is my colleague, Lisa, who has been our technical lead from Accenture on really building out this tool. I'm going to be really brief. We're used to doing demos quickly. So Lisa, here's another test. So first off, California Volunteers is a state office tasked with engaging Californians in service, volunteerism, and civic action. And we created and launched this tool, as you can see here, MyTurn Volunteer, in March to really help clinics recruit medical and non-medical volunteers if they are involved in the Mycavax MyTurn clinic system. So Lisa, I'm going to go ahead and turn it over to you so you can show a quick demo and take us home.
Wonderful. Thank you for the intro. Thank you everyone for being here. So MyTurn Volunteer does help facilitate looking for volunteers who can help clinics give vaccinations. Here I'm in a contact card for a certain volunteer. And one very cool thing about MyTurn Volunteer is that you can request volunteers who are bilingual. So if you have community needs that you might like some help on, there is a section for people to volunteer in general, raise their hand and say, I'm interested. And the California volunteers team, like Donna, will be able to send a mass email blast to everyone in your area by a zip code to say, hey, there's a shift available. Would you like to help your community? And once the volunteers see that, they're able to look by location and volunteer type. We have medical and general support. So our medical volunteers they have a medical license and they can administer the vaccine. There's tests, balances, training involved, et cetera, involved in this. And the general support is more like crowd control or helping registration. And once a volunteer is searching for locations, they're able to see clinics or providers in their area who have vaccine shifts and events going on. And then they're able to look at these shifts, and they can also see if there's roles that require another language. So here we see this is a volunteer role for a couple hours to vaccinate. They need somebody who speaks Spanish. So I can click on this and add that to my shopping cart as a volunteer. And then I can continue looking throughout the next couple of days and pick the days that work for me so that I can help clinics vaccinate more people in their communities. Once I click continue, I enter my personal information as well as my medical license. There's a lot of automation involved. So this medical license number is actually checked against the Department of Consumer Affairs. So that means that clinics or pharmacies or providers are able to kind of expedite that process and know if that volunteer is in good standing or not. So here we see Sunflower, our fake volunteer from the test site. She's a physician. We have her medical license. Automatically, this says, yes, it's in good standing. There's also workflow to help with background checks. The site does not actually do the background checks, but we incorporate this workflow here. And the California Volunteers team is happy to help if resources or other options are needed. Once this is completed, we can say this volunteer is a good fit through this status. And then the volunteer is given information for training. They're given reminders. They're given a lot of information that helps create that flow so that the people at the clinics and providers do not need to do as much manual work. So here we can see the training that a volunteer must go through. When they sign their name at the very bottom saying that they've completed it, that is automatically sent back to the system so that volunteer directors at clinics can see that this volunteer is a good fit. Once this is saved, the volunteer will get reminder emails leading up to their shifts, along with the ability to cancel. So all of that is automated as well. And this way, clinics can get the help that they need that are really tailored to their communities. We've had a lot of success with clinics who are looking to do outreach with a lens of equity right now. So some of our people using MyTurn Volunteer, they actually have volunteers walking around the neighborhood, literally pointing, there's a clinic down the street. I know you might not know about this. Would you like to get vaccinated, or can we talk to you about this? So the volunteers are able to help mitigate vaccine hesitancy. They're able to share information. They're able to do this in the language that is most comfortable for these communities. And they're able to help these clinics who are trying to vaccinate people, but might need a little bit of help. So with things like this, we have a couple of case studies. For example, one clinic was doing 250 vaccines per week, but once they started using MyTurn, they did 800 in a day with volunteer support. So they're able to greatly increase the number of vaccines given to their community. And this particular person, not only is he vaccinating people, he's telling them, I have a parking lot outside of my pharmacy. If you park there and you cannot move, if you are afraid to come inside, we will come out to your car and we will help you. Just let us know. And all of these can be scheduled through the MyTurn system, or a lot of clinics are doing walk-ins, and those volunteers literally pointing to the clinic down the street are able to get those people in. And then we have people there to help them get registered. We have people to follow up. We have people to have that conversation. And all of it is data driven. So here you can see, as a volunteer director, I see statistics, I see information about volunteers by type, both general and medical. And if I need to, I can contact all of these volunteers at once through my system, or I can download spreadsheets if you have any kind of data or reporting, or if you want metrics for your clinic needs.
Thank you so much, Lisa, for that demo. Want to just say I put my email address in the chat if you all are seeking a more in-depth demo. We do those all the time for particular clinics or even events. And also wanted to flag that we have AmeriCorps service members who are trained in disasters and who are able to work full-time at either a vaccination clinic or with a community-based organization to do contact tracing or to assist with volunteer recruitment. So if you have any of those interests or needs or know of clinics or organizations who do, please reach out to us at MyTurn Volunteer at cv.ca.gov. Thanks.
Both so much. I love that. I think that's a really easy to use tool, and I'm so excited that we were able to share that tonight, although quickly, very thoroughly. So thank you so much. Thank you both. I just want to thank everyone for joining us tonight. NHMA really appreciates your participation, your attention, and I just wanted to bring your attention towards our website. You can follow us on social media, keep up to date with all of our programs, and we would love to get you included in any of our programs. We have many more outside of the ones that were discussed tonight. And I also wanted to highlight, we are having our gala, our scholarship gala that Dr. Picasso was talking about earlier. We also have our annual conference coming up in March. So I encourage you all to take a look at our website and register for that. And thank you guys for your patience. I know we went a little over time tonight, but thank you all for being here, and thank you to the panelists for your time.
Thank you, everyone. Have a good evening. Excellent job. And I know this is recorded, so we'll definitely share. Thank you, everyone. Good evening.
Thank you.
Thanks, everyone.
Bye.
Good job, Ariel.